Okay. So, this is Christine. And Christine, you've come to our office and your initial complaints were?
Well, I had many complaints. I felt weak in my upper back and neck. My neck was bothering me. I had disc problems I had found out through MRIs. I had pain in my arm. The thing that was scaring me the most is it was weakness, and I wasn't able to do much, and so I had a lot of pain going on, so therefore I was stopping most everything I was doing in my life. So I would say pain in my upper body.
Okay. And what did you try to help with this condition? Like, what did you try anything before coming here?
Yes, for 2 years this happened. Started about 2 years ago. The first thing I did is I went to a traditional chiropractor, but that just seemed to create more pain in the adjustments they were doing in my neck. I would get severe headaches, and he tried putting me in traction. That created a lot of pain for me. So then I went to an orthopedic man and a doctor, and he, put me in physical therapy. And physical therapy hurt me. I would take one step forward and 2 steps backward. I just couldn't seem to come out of the pain. It was crippling, and I would ice, I would heat, I went for massages. When I couldn't come out of that, then I decided to go see a neurosurgeon. And the neurosurgeon told me that I would need surgery between my 5th and 6th vertebrae, maybe even my 3rd and 4th. I had extra bones growing, arthritis, disc problems. But it really scared me because it was going through the front of my neck, and so those are all the things I tried until one day I heard 2 women speaking in my office.
Interesting. Okay. Now, how did this condition affect your home life, your work, relationships, hobbies, anything like that?
It affected every aspect of my life. The first thing it affected was work. I was using my arm a lot, so all of a sudden I couldn't do that. I'd be in terrible pain. And then it was affecting my home life. Couldn't vacuum, couldn't clean. I couldn't even brisk walk with my husband, and we enjoyed doing that. We would walk down at the beach. We were very active. We played golf. I couldn't do anything. It affected every aspect of my life. And therefore it was depressing me. I was crying a lot. I was very unhappy.
And through all that, how do you feel now?
Through all this, I'm shocked, because in doing this, it made me reflect back, because you tend to forget. And so it made me think, I am back being really active again. I'm working a lot of hours at work. I'm cleaning at home. I'm planting mums in my yard. I am definitely a stronger person. I'm not exactly where I'd like to be, but I cannot believe how different I am. I am definitely so much stronger.
So now that you're feeling this way, would you want to continue on what's called wellness care, which means you will continue care so that you will stay well? And if so, why?
I would never not continue this. It's changed my life. Even if I am going to Florida for a month in February, but going forward I may go, for a couple months here and there. I would fly back. He's changed, this has changed my life. It's made me realize that, there was another option, that I didn't have to do surgery, and he has made me a much stronger person. So I would never give this up.
So what would you say to others that would be considering using upper cervical chiropractic and that are unsure about it? What could you tell them?
Well, I would tell them what 2 women told me. I was at the end of my ropes. I had nothing left to try. And I own a store, and 2 women were talking on the same day about Dr. R. Beitman and the upper cervical chiropractic care. And they said it changed their life, and it was definitely life-altering, and that it was the next step I should do. So I would tell everyone the same thing. I didn't know if I totally believed it, but I had no other place to go. So this was my last place, my last stop before surgery. I don't need surgery. I feel stronger. I'm getting better every day. Every now and then I'll have a little blip, but I totally recover now. So I would tell everyone else that they would definitely have to try this. So,
Well, thank you very much. Appreciate
you.
that.